So the fourth way that we can build positive relationships at the front desk so that our patients have better outcomes is by setting the tone for what the visit will be like. When a person walks in your office, it's the front desk's responsibility to set the tone how everything else in the office will go. And unfortunately, the most common thing that front desk staff does is set a tone of cold information collection. Not warmth and healthcare, but rather cold information collection. They hand a clipboard of information that needs the same information filled out in 5 different places. This is 2023, stop. Just stop asking people to write their address on 17 different sheets. It's disrespectful because it's saying that their time doesn't have value whereas yours does. Ask for things one time. Look through your intake material and ensure that you only ask the same question once. Now, the medical information, it's very important to ask the same question in different ways. But is it really important to ask for the insurance policy name 5 different places or to get 6 different signatures about who's financially responsible? In the end, those things don't matter. What really matters is setting the tone for a warmth relationship. So I would encourage you, trim down your intake as much as you can. At the same time, when you trim down that intake information, people want to feel like you understand them. So there's good research to say collecting information via text message can help build a relationship. The reason text message is so effective is, number one, it requires us as providers to cut down frivolous information and only ask the information that's very important. It also allows us to ask those questions in a format that that patient is used to. That text message is how they ask their, girlfriend where they want to go to dinner, or they ask their parents where they want to go this year for vacation. We are used to information collection via text message, but you don't want to send 28 different questions that need to be filled out. Instead, send a few and then use that information to provide better care. But the front desk sets the tone, and if we're not using names at the front desk, that's a negative. That outcome will be worse in the back. If we're overwhelming with asking them to fill out information, the outcomes will be worse. If we're cold, outcomes will be worse. Yet if we're warm, welcoming, use their name, the research is clear that we will see an improvement of patient satisfaction and health outcomes.